Hello. Today, we're going to discuss Scattered Minds by Dr. Gabor Maté. This book is a must-read for anyone looking to understand attention deficit hyperactivity disorder, ADHD, in more depth. Dr. Gabor Maté is a well-known physician, author, and speaker who has spent decades researching and treating patients with ADHD. Maté was diagnosed with ADHD at the age of 52. The book argues that ADHD is not a disorder of attention, but rather a disorder of regulation caused by a combination of genetic, environmental, and developmental factors. The book provides a holistic approach to treating ADHD, emphasizing the importance of addressing the underlying emotional and physiological factors contributing to the condition. The author suggests that traditional approaches to treating ADHD, which focus on medication and behavioral therapy, are ineffective in addressing the condition's underlying causes. Dr. Gabor Maté, a physician and author, has proposed that trauma can significantly contribute to the development of ADHD.
So trauma is not just personal, it's also cultural and it's historical, and it's also transgenerational. And we just can't help passing it on. So if I carry trauma, I can be sure to pass it on to my kids unless I've resolved it, worked it out. And to the extent that I've resolved it, I won't pass it on. And to the extent that I haven't resolved it, we do pass it on.
He argues that traumatic experiences in early childhood, such as physical, emotional, or sexual abuse, neglect, or exposure to violence, can disrupt the nervous system's development and lead to hyperactivity, impulsivity, and inattention. Trauma can also lead to hyperarousal and hypervigilance, making it difficult for a child to focus and pay attention in a classroom setting. Trauma can also affect how a child processes and expresses emotions, which can lead to difficulties with impulse control and hyperactivity. It's important to note that not all individuals with ADHD have a history of trauma, and not all individuals with a history of trauma will develop ADHD. However, research suggests that a history of trauma can be a risk factor for developing ADHD. Dr. Maté's trauma-based approach emphasizes addressing underlying traumatic experiences to treat ADHD effectively. It also highlights the importance of a holistic, individualized approach to treatment that addresses not only the symptoms of ADHD, but also the underlying emotional, social, and developmental issues that may contribute to it. The book provides practical strategies for improving focus, reducing impulsivity, and building resilience by addressing the underlying emotional and physiological factors. Here are a few examples. Nutrition and exercise. Maté emphasizes the importance of a healthy lifestyle in managing symptoms and suggests that individuals with ADHD should avoid processed foods, sugar, and artificial additives. Sleep. The author stresses the importance of adequate sleep and suggests that individuals with ADHD should establish a regular sleep routine. Emotional regulation. Individuals with ADHD can improve focus, reduce impulsivity, and build resilience by learning to regulate their emotions through cognitive behavioral therapy, dialectical behavior therapy, and emotional freedom techniques. Also, addressing underlying traumas and emotional issues through therapy, such as psychoanalytic therapy, attachment-based therapy, and somatic therapy. Medication. The author acknowledges the importance of drugs in treating ADHD, but also points out that it is not a standalone solution and should be used in conjunction with other strategies. It's important to note that the strategies may vary depending on the person, and the best approach is to seek professional help and guidance to figure out what works best for you. The book also offers guidance for parents and caregivers of children with ADHD.
And so more and more parents are stressed. Guess what? More kids are going to get diagnosed. And then we say, the kid's got a disease, let's give him a pill. Rather than looking at, well, what is it about the environment? Because the good news is, and I'll talk about that later again if I have a chance, is that the brain can develop new circuits, as I mentioned before. The question is, what conditions is required for that? And if we really understood the implications of the science and the wisdom, then the questions would be asking ourselves, okay, If all these kids are developing problems, what conditions are causing that, and what conditions do we have to create to lead them in a new direction, to help them reconnect?
Providing strategies for managing symptoms and improving quality of life. Here are a few examples. Create a structured environment with clear rules and routines. Encourage them to engage in regular physical activity. Teach them emotional regulation strategies, such as mindfulness and breathing exercises. Encourage them to eat healthy and exercise daily. Work with teachers and other professionals to ensure their educational needs are met. Be patient and understanding when dealing with children with ADHD, as it is a challenging condition. Seek professional help, such as counseling or therapy, if they struggle to manage their child's symptoms. The book is a valuable resource for anyone looking to understand and manage ADHD, including those with ADHD, their family and friends, educators, and healthcare professionals. If you're interested in learning more about ADHD, be sure to check out Scattered Minds by Dr. Gabor Maté. Thanks for watching.